Back to the Factor Uncensored. We're learning more about medical conditions tonight. Despite what you may think, strokes are not exclusive to certain age range. Older people, is that what you think? It can happen to someone in their 20s. My next guest explains why. Dr. Danish from Archpoint Pain Institute joins us here on the Factor Uncensored. Dr. Ali, Snoop Dogg's daughter, KRIV, who's 24 years old, suffered a stroke. She described it as severe. The question is, what is a 24-year-old doing having a stroke? And we've heard cases of other young people having strokes.
That's correct, Isaiah. It's very scary, and yeah, it really puts some things in perspective. Again, we don't know lots of details. She just posted about this on her Instagram, and that's where we're learning about this. What we do know, Isaiah, is that she has a history of lupus, which is an autoimmune disorder. And what that does is it causes inflammation throughout in the body, and it also inflames the blood vessels. And when you have an inflammation of the blood vessels, those can start to leak. And when you have a leak, you can develop, and especially if it's in the brain, you can get a stroke that way. And we call it a hemorrhagic stroke, right? Mm-hmm. It's not one of the common causes of strokes. However, we do see that. And lupus does put you at a twofold increase to potentially develop a stroke in folks that have that disorder. And so that's what we're speculating. We don't have a lot of information at the moment, Isaiah. And what we know is that this was a form of a stroke, and what she describes as severe. I did notice that she had a mask on, and so she may be having some significant facial asymmetry. She may be having significant arm or leg weakness as well, and maybe even difficulty with speech. So those are all symptoms of strokes as well. And so there's that acronym FAST, which is facial asymmetry, arm weakness, speech difficulties, and the last is time. That's the most crucial thing about this, Isaiah, is that folks, if they develop any of these symptoms, need to get to a hospital immediately.
Now, we know, and obviously strokes are not typical with young people, but we know, like many athletes, they're out in the heat and they get what we call a heat stroke. How is that different from the standard stroke that many of us know?
Sure, Isaiah. Sure, stroke in general is the same, very similar to saying a infarction. Infarction is very similar to saying there's no blood supply to a specific area, right? Folks get myocardial infarction, which is also considered a heart attack. Heart attack is where you don't get blood to a specific blood area in your heart that needs the blood, right? Same thing happens in your brain. If you don't get a blood supply to your brain, whether it be because of a clot or whether it be because of a bleed in your brain, that can also cause a stroke. So it's all very similar. It just means that there is no blood supply. Blood contains all the nutrients, it contains oxygen, everything that that body or that organ specifically needs. And when it doesn't reach to that area, that's where we call a stroke, a heart attack, a heat stroke, anything of those natures.
And what are some of the signs that people can look for in case they are not aware they're having a stroke? What are some of those signs that would tell you, get to the hospital, get to your medical care provider as soon as possible?
Yeah, so one of the acronyms is FAST, as we talked about, which is the facial asymmetry, arm or leg weakness, difficulties with vision is another one, blurry vision, or sometimes folks describe a numbness, tingling, weird sensation going down the arm that's very acute, or it just comes on suddenly. Also, we talked about the balance and weakness. And those are all symptoms that you want to be looking for and be aware of. And most important thing is, Isaiah, getting to the hospital, because there are medications, there are clot busting medications that can bust those clots in those brains or in the heart that can potentially reverse some of the long-term side effects that you may have otherwise.
And I would assume, obviously we know debilitating it can be. Could it be deadly as well?
Oh, for sure. Yeah. Strokes are very common causes of deaths in America here and all over the world. And so And the other thing is they do cause long-term side effects as well, whether it be weakness, facial asymmetry, talking difficulties, difficulties in eating. Those are all things that we see, especially in the hospital, especially in the rehab hospital as well. We see folks that need lots of therapy, lots of re-education, retraining of those nerves that need to begin again after this sort of incident happens.
All right, Dr. Danish Ali, Archpoint Pain Institute. Thank you for joining us tonight, sir.